Hi, I'm Mark from Passport Medical. I'm here today with Dr. Marcial Fallas from Hospital Clinica Biblica in San Jose, Costa Rica. Thank you for seeing me today, Doctor.
It's a pleasure to be here.
Could you start off by telling us a little bit about yourself?
Okay. I am, as you already said, I am a vascular surgeon, so I've been practicing medicine for 12 years. And right now I'm working in this private hospital for the last 3 years. I have done my studies here in Costa Rica most of the time. I did my med school here in Costa Rica, and I did my specialty in vascular surgery here. And after that I went to do some fellowship in Germany, and I spent some time also in Spain, in Barcelona. And I have been in different places around the world doing different trainings. I've been in Chile, I've been in Mexico, I've been in the States. So I've been trying to have different trainings in different parts of the world. And as I don't know if everybody knows what a vascular surgeon does, but we work in arteries and we work in veins. And in the last year, it's been like a boom about the work in different parts of the vein part. And we are starting to have different treatments, like the CCSVI, which I get involved in this since last October when I went to this meeting. It was in Monaco, and I had the opportunity to see Dr. Zamboni speaking about the results that they have in Italy. And it was very interesting because we have many patients that probably have the same disease, and we are not suspecting that, so we want to start to doing this kind of work. And I think that I get lost.
Perfect. That's great. And I know that in Canada and the United States we have many people with cerebrospinal venous insufficiency, and we've been actually talking now for several months about this and bringing patients here not only for testing and screening but for the actual CCSVI Liberation treatment. Maybe we could talk about a few other things around CCSVI. What are your thoughts on ballooning versus stents in the CCSVI procedure?
Yes, there are many places in the world are doing this procedure, and they are trying to do the same techniques that they have in the arteries, in the veins. But we know that our different territories has different behavior. I mean, you won't expect to have the same results working in an artery than working in a vein. And if we go to the papers, the ones that have the people that have most experience, they don't recommend the use of stents. So I think that at this moment, for what we know about this disease, the best treatment to do is to go with the ballooning right now, because we don't have so many experience with the arterial stents in the vessels. How is this going to be in some months? So I think that the best treatment right now will be to do the ballooning and wait to see if they have like a special stent for the venous part.
Perfect. And we've also talked a little bit about pre-screening, because obviously the screening of the patient for cerebrospinal venous insufficiency is very important. We've talked about MRVs, we've talked about Dopplers, we've also talked about venography, sure. So we're thinking to begin.
I think that if you get to look to the papers, they have different results in different parts of the world, and if you really read the papers, you will see that they are using different techniques to do the test. And the gold standard is to do it with the venography. So I think that at the beginning it will be good to do with the venography and start from that part, and according to experience, let's see how it's going.
Perfect. And you also think that by doing the venography, to do that, it is invasive. So when we're already in, it would be appropriate to do the ballooning at the same time. Is that correct?
Yes, I think that if we are already there, if we have access to the vessel, if we are in the vein and we found that we have a problem there, we can solve the problem at the same time. So you don't have to go to the operation room like 2 times, and it will be easier. It will take less time.
In your estimation, how long do you think the operation will take from beginning to end?
Yeah, We expect we think that it will take like around an hour, but we have to be honest, and the venous part, it has many variables, so it will be around an hour, hour and a half.
Approximately an hour and a half. Excellent. And do you think from beginning to end, people coming to Costa Rica for testing, for treatment, for follow-up care, what do you recommend in terms of people being here in Costa Rica to best treat the patient?
Okay, so we are trying to make this group, and this group is preparing to treat the patients in different fields. There are not only vascular surgeons. We have neurologists, and we have people, therapists, and also internal medicine specialists. So I think that we would like to have the patients. The best way to do this, I think that if the patient stays here for some days and have some rehab here, so I think that it will be like 10 days to spend in the country.
Fantastic. Well, Doctor, I really want to thank you today for introducing yourself and for introducing Hospital Clinica Biblica and for talking a little bit about CCSVI Liberation.
Okay,
Thank you very much.
My pleasure.
My pleasure too.